Hi guys, my name is Ashley Chisholm and I'm a nurse practitioner student at Auburn University. Today I will be presenting a PowerPoint presentation on influenza. Influenza, also known as the flu, is a highly contagious acute respiratory illness. It is caused by the orthomyxovirus influenza types A and B. This virus occurs worldwide and the most frequent time of occurrence is during winter months. The prevalence is typically higher in school-aged children. It can cause significant morbidity in some patients. However, the prognosis is good in most cases. Who is at risk for influenza? Individuals who live in closed or crowded conditions, have poor hand hygiene, diagnosed with chronic diseases, have weakened immune systems, or women who are pregnant. Here I've listed a few questions to ask as a provider when diagnosing influenza. The first question being, what test will help me diagnose influenza? Just a clinical pearl, during the flu season, a diagnostic test is usually not indicated. However, a reverse transcription polymerase chain reaction test is the test of choice. A lot of primary care clinics are using rapid tests to help diagnose influenza. However, these tests give false negatives sometimes. The second question being, if you use a rapid test and you get a negative, what to know in order to diagnose influenza? You should know that a negative rapid test result does not rule out influenza as a diagnosis. Fever, cough, and other systemic symptoms are important clinical indicators that the patient may have influenza. The third question being, how long has the patient been ill? Should the patient be treated with antivirals? You want to know how long the patient has been ill because antivirals are only considered during the first 48 hours of symptom onset. They are considered for patients who are at high risk for complications or healthy patients who want to shorten their illness by a day or two. Physical examination components. A physical exam should exclude complications such as otitis media, pneumonia, sinusitis, and bronchitis. Influenza is marked by the inflammation of the nasal mucosa, the pharynx, conjunctiva, and the respiratory tract. So patients may present with fever, chills, dry cough, nasal congestion, rhinorrhea, sore throat, malaise, myalgia, and headache. Here I've listed the most common treatments. Supportive care and symptomatic treatment is the most recommended unless you have patients who are at high risk for complications. You should encourage patients to use nasal sprays, chloroseptic throat sprays, antipyretics, and analgesics. You should also encourage the patient to rest and increase fluid intake. Here I've listed the antiviral treatment options. And again, you should be reminded that they should only be administered within the first 48 hours of symptom onset, and they may only shorten the illness by a day or two. The three common antiviral drugs are oseltamivir, baloxavir, and zanamivir. Some of the priority teaching points for the patient. Prevention is key. You should make sure the patient understands that they should wash their hands, cover their cough, and avoid crowds during their time of illness. Everyone 6 months and older should get vaccinated. Symptom management is the most recommended treatment for patients with low risk for complications. Antivirals may only shorten illness by a day or two. So healthy patients should be reminded that they will have gradual improvement within the next 3 to 5 days, and to make sure that they are comfortable in managing their symptoms with over-the-counter medicines. The third point being adequate fluid intake, rest, and smoking cessation if the patient is a smoker. And that is my presentation on influenza. These are my references, and thanks.